Welcome. I'm Dr. Thomas Gerber, Associate Editor of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has selected as Editor's Choice and Highlights for the March 2014 edition of our journal. This month's Editor's Choice is the special article Drug Shortages, a Complex Healthcare Crisis by Dr. Erin Fox from the University of Utah in Salt Lake City and colleagues from several national healthcare institutions. The authors argue that the ongoing drug shortage problem in the United States is, in fact, a form of healthcare rationing that affects clinicians and patients on a daily basis. The accompanying editorial, Looking for the Treatment for Drug Shortages, Not a Simple Prescription, was authored by Dr. Arnold Berry from Emory University in Atlanta, Georgia. Here's one of the questions the editorialist wants you to consider. How do you tell a patient who has recently received a diagnosis of cancer that the first choice chemotherapy agent for his treatment is currently not available? One of this month's featured highlights is the original article Contamination of Stethoscopes in Physicians' Hands Following a Physical Examination by Dr. Yves Longtin and colleagues from the University of Geneva in Geneva, Switzerland. Based on their data, the authors make the point that the stethoscope should be regarded as an extension of the physician's hands and should be disinfected after every patient contact. The accompanying editorial, Auscultation and Healthcare-Associated Infection, was written by Dr. Dennis Mackey from the University of Wisconsin in Madison, Wisconsin. Among many other insights, Dr. Mackey points out that the efficiency of transmission of methicillin-resistant Staphylococcus aureus from the body of colonized or infected patients to the hands of healthcare workers and their stethoscopes is almost staggering. The other featured highlight in this month's issue is the review article Alcohol and Cardiovascular Health, The Dose Makes the Poison, or the Remedy, by Dr. James O'Keefe from the Mid-America Heart Institute in Kansas City, Missouri, and colleagues from other national healthcare institutions. Based on their PubMed literature search covering 15 years through 2012, the authors conclude that daily low to moderate dose alcohol intake, in particular red wine before or during the evening meal, is associated with the strongest reduction in adverse cardiovascular outcomes. And to remind you yet again, in 2014, Mayo Clinic will be celebrating 150 years of patient-centered care since Dr. William Worrell Mayo opened a practice in Rochester, Minnesota in 1864. As part of this sesquicentennial celebration, Mayo Clinic Proceedings will feature a number of articles that highlight our accomplishments in patient care, education, and research. This month's sesquicentennial feature is the article, You Trained at Mayo Clinic? Wow! By Dr. Mark Warner from Mayo Clinic in Rochester, Minnesota. Dr. Warner is the Executive Dean for Education at Mayo Clinic. Our new online-only Mayo Clinic Proceedings Legacy section will feature Eleanor Clapier, who was the managing editor and only woman on the first 1964 editorial board of Mayo Clinic Proceedings. There are also notes on a historic Proceedings article on vitamin K in the treatment of jaundice, the role of Dr. Hugh Butt. This month's contribution to our ongoing symposium on regenerative medicine, entitled Cellular Therapy in Liver Disease, was authored by Drs. Robert Hubert and Jorge Raquela from the Mayo Clinic campuses in Rochester, Minnesota and Phoenix, Arizona. This article provides teaching exercises for which you can receive up to 1 hour of CME credit if you complete the appropriate documentation. Also featured on the cover page of our March 2014 print issue are the following articles. The special article, Racial Disparities in Survival for Patients with Clinically Localized Prostate Cancer Adjusted for Treatment Effects, by Drs. Mark Tyson and Eric Castle from Mayo Clinic in Phoenix, Arizona, and the review article, Leadership Models in Healthcare, A Case for Servant Leadership, that was authored by Dr. Victor Trastak from Mayo Clinic in Phoenix, Arizona, and colleagues from the University of St. Thomas School of Law in Minneapolis, Minnesota. Dr. Trastak is a former Chief Executive Officer of Mayo Clinic in Phoenix, Arizona. Video interviews are available with authors of most of the articles mentioned in this recording and some others as well. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Check out our new interactive Path to Patient feature, which is curated by my associate editor colleague Dr. Lori Erickson from the Department of Laboratory Medicine and Pathology at Mayo Clinic. Also on the website, our series entitled Editorial Board and Staff this month features Dr. David Anders from the University of Wisconsin-Madison, who has been our section editor for infectious diseases since 2008. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and the other outstanding articles in the March 2014 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the next issue of Mayo Clinic Proceedings, which will go live on our website in April 2014, will contain articles entitled Epidemiology of Emergency Department Visits for Opioid Overdose, a Population-Based Study, Latest Advances in Chemotherapeutic, Targeted, and Immune Approaches in the Treatment of Metastatic Melanoma, and Breast Density and Breast Cancer Risk, a Practical Review. In the meantime, you can watch videos related to our journal content on our YouTube channel. You can also follow us on Twitter and like us on Facebook to stay up to date on online first publications and on breaking news related to our journal. Direct links to our YouTube, Facebook, and Twitter presences can be found in the upper right-hand corner of our homepage. Recording on another crisp, read wind chill minus 27 degrees Fahrenheit, Minnesota day, I remain yours until next month, which will hopefully be warmer.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.